evening, everyone, and welcome to another edition of Health Matters, the public information television show jointly sponsored by WCCA TV, Channel 194, and the Worcester District Medical Society. I'm your host, Dr. Michael Hirsh, and I'm very privileged to say that this is our 200th Health Matters show, and we have some very special guests, and it worked out very well that we had two very special people for this special show. Dr. Sara Shields, who is a professor of family medicine at the UMass Medical Center and is very, very involved in lots of aspects of perinatal family care, and is going to tell us a lot about the Worcester Healthy Baby Collaborative, and one of our prize medical students who's been involved with the WHBC for quite a while, Vanessa Villamarin, who has done a number of very interesting and important projects related to infant mortality, which is the basic premise for why the WHBC exists. But I'm going to turn it over to Dr. Shields to tell us a little bit about WHBC and infant mortality in central Massachusetts, and why are these things looked at as a bellwether of public health and wellness?
Great, thanks so much for having us. We're really excited. It turned out to be the 200th show, so that's great. We like to say that a baby's health is a city's wealth, and that's a quote from the wonderful Dr. Leonard Morse, who was the Commissioner of Public Health for the city of Worcester for a long time. And at one point we had actually put that on a bumper sticker. We think I like it because it talks about how a city and a community really should own the health outcomes of that community. And we feel at the Worcester Healthy Baby Collaborative really dedicated to try to improve infant health in the city of Worcester. So that slogan is sort of one that we like to quote.
And I would probably say if you looked in the archives, out of the first 50 shows that we did, maybe Dr. Morse was on 30th.
Right. Okay, so it's good to mention him on this 200th show.
Yes.
So our group started in the mid-90s as the Worcester Infant Mortality Reduction Task Force, quite a mouthful, and we were formed in response to the fact that the state was telling us that we had a much higher infant mortality rate than similar cities in Massachusetts or than the state as a whole. And we've learned over the years that not only is our infant death rate higher, but we have significant racial disparities. So Black and Hispanic infants are 2 to 3 times more likely to die before their first birthday than white infants in Worcester. And so we really have been committed in the almost 25 years that we've been working to try to address those racial inequities and try to improve those outcomes for all babies in Worcester. Our mission is really to be a diverse and passionate coalition of maternal child health professionals, such as yourself, and community leaders and public health folks. So we work closely with the Division of Public Health. And we want to improve health outcomes for babies and their families in all of Worcester, and we want to do it through engaging and working with the community, because we know that we can't just come to the community and say we have all the answers and we have the right ideas. We need to listen to the community around that. And our goal is to decrease Worcester's infant mortality rate and let every baby and every family thrive and prosper. So that's sort of our mission statement. I'll talk a little bit about what we mean by infant mortality, because I think sometimes people get a little confused by that. Infant mortality is defined, or the rate is defined, as the number of deaths of an infant before their first birthday divided by 1,000 live births. So nationally, the U.S. number is about somewhere sort of 5.6 to 5.8 deaths per 1,000 live births. So it's not a percentage, and I always like to say if we had 5 or 6% of our babies dying before their first birthday, we should all quit our day jobs and work on that. In fact, what we learned in Worcester in the 90s was that for Black infants, 20 to 30 per 1,000 live births. So in fact, 2 to 3% of Black babies were dying before their first birthday. So that's kind of what got our organization going.
And when when we see these kind of disparities, I know from sitting on the collaborative for several years now, we've really utilized a lot of epidemiologic studies to inform like where and whom should be targeted. So maybe you could explain a little bit more about, like, I know we had a special task force that was dealing with just the Ghanaian population because they seem to have an elevated number of infant mortality episodes.
Right, so in the 90s what we were seeing was this much higher Black infant mortality in Worcester, and it was Worcester's Black babies are mostly born to immigrant women, and at that time it was largely in the Ghanaian community. And one of the things we tried to do in terms of outreach to the community was to go to churches and talk to Ghanaian leaders. And in the sort of mid-2000s, we were lucky to get connected with a Ghanaian woman who was a public health nursing student at Worcester State, and she brought another nursing student with her. And they really connected us to people with voices in the community, someone who ran a radio show, and they were the ones that encouraged us to change our name. They said, we are tired of hearing about death. We want to talk about health and wellness and prevention and nutrition. And so they helped us change our name to the Worcester Healthy Baby Collaborative, which is a little bit less of a mouthful and tries to target and emphasize the importance of health. They also worked with us on a project that we ended up calling the Nshira Ba Project, and that's the Ghanaian phrase for blessed baby. We partnered at that time also with the state chapter of the March of Dimes, and they helped us get a curriculum from that they had about sort of prenatal education and nutrition and infant wellness, and we sort of adapted that to the local Ghanaian community. And with that, they created a Facebook page. They helped translate materials from a national program called Text for Baby into Twi, which is the Ghanaian dialect. And they developed with some students from WPI videos of in a Ghanaian restaurant to teach both patients about healthy eating with Ghanaian foods, and also to teach providers in the Worcester maternal and child health area around how to advise pregnant women about their diet with culturally, food from the Ghanaian culture. So that project was so successful and sort of really engaging with the community that we took that mantra that we needed to be by the community, of the community, and for the community for any further sort of public health work that we wanted to do around infant mortality. And we've been lucky to see the Black infant mortality in Worcester has gone down in this time, and in fact in I think it was the sort of 2014 to 2016 period, the Black infant mortality in Worcester fell below the Hispanic infant mortality for the first time. In 2000, starting in around 2004, what we started to see, and we can show the graphs now if we have them, a real spike in Hispanic infant mortality in Worcester that lasted for about 10 years. And the really interesting thing about that was that it wasn't something we were seeing in the state or nationally. So you can see the curve, that sort of blue curve in the middle there is the Hispanic infant mortality going up, and the orange at the top is the Black one coming down. Mm-hmm. And this was happening here in Worcester, but not in Massachusetts. The Hispanic infant mortality rate in that time stayed pretty steady, as it did nationally as well. And so we sort of looked at that. We saw this and said, well, is it about, we knew that the Latino community in Worcester experiences more poverty, but this predated the recession of 2008. We know that the Latino community has really struggled with the opioid epidemic, but again, these numbers predated that. Mm-hmm. And in fact, most of Worcester's infant mortality, as we've looked at the chart reviews that we are able to do almost in real time, so we're really about 2 to 3 years ahead of where the state is, it's not driven by opioid or substance use. That's not the reason why babies are dying in Worcester. So we looked at those numbers for the Hispanic community and sort of puzzled about them and tried to engage more with the community And I think that sort of led to our baby box project, so I can talk a little bit more about that. But I do want to say that the causes of infant mortality there's sort of two main causes. One is babies that are born with birth defects, and the other is babies who are born very prematurely. And in Worcester, most of our infant deaths are about extreme prematurity, so babies who are born much too early to survive. We have incredible health care in Worcester. We have great community health centers that provide access to women. I work at one of them, the Family Health Center of Worcester. We also have a state-of-the-art, nationally recognized neonatal intensive care unit, so we can take care of very ill and very premature babies. We have excellent maternal fetal medicine specialists to help when mothers have high-risk issues. We know that extreme prematurity is really a lot about a mother's health before she's pregnant, and so to try to prevent infant death, we tell people try to be as healthy as you can before you get pregnant. So try to be a healthy weight, don't smoke, don't drink, take a vitamin called folic acid if you know that you're planning to be pregnant, and get to the doctor as soon as you know you're pregnant so that you can sort of the doctor can help you assess your health issues and all of that.
So when the collaborative was coming up with this new kind of alarm about the Latino community, how did you kind of latch on to the baby box as a way of maybe making some of the issues in infant mortality get reduced with it?
Great. I'm going to
maybe,
actually let Vanessa tell us about that. She's been working on it.
Amazingly hard.
Oh, thank you. Yes, so as Dr. Shields was speaking about earlier, what we learned from our work with the Ghanaian community leaders was really to have a solution that's really community driven. And so in 2016, we received a grant from the Massachusetts March of Dimes to work with and engage with the Latino community here in Worcester. And then in 2017, we received the Remillard Family Service Award. So that went towards the efforts of distributing the baby box, and I'll speak about that in a little bit too. But basically, what we did in the fall of 2016 was we held a forum where we had many different community leaders, and again, a lot of the Latino community members were represented. And so we, through that and also through health fairs during that time as well, we really tried to connect and engage with the community to come with solutions to these issues or hear the opinions of what was going on.
So, Vanessa, when you first got here as a first-year medical student, did you have an interest? Now you're third year. I mean, obviously you've devoted a lot of time to this. How did this project kind of strike you, and why did it kind of resonate that you were going to try to make a dent in this?
Yeah. So I've always been really passionate about working with underserved communities. That's the whole reason I went into medicine in the first place. And so where my love for moms and children and families came from was before medical school, I used to work here at UMass with Dr. Christina Delagenidis on postpartum depression studies. And so I had the honor of working really closely with a lot of moms in the area and following them through their pregnancy and postpartum period as well. And so getting to know them and seeing all the hardships that different women from all walks of life go through gave me a passion to work with women and children. And then getting into medical school and learning about all the possibilities and learning about Dr. Shields' work, it was something that I was just immediately drawn to.
It is it's one of the more positive collaboratives out there. When you go there's a certain energy that we're gonna make a difference, and sometimes you get to other organizations, and I do attend to a lot of them, and it's not as positive and not as welcoming either. So I think you guys do a wonderful job in trying to get a lot of new faces involved, and there's always a interested group of students that are really working hard with Dr. Shields on this. So kudos on that.
We've been really lucky that we have summer students sponsored through UMass that have worked on the project for, I think this summer will be our 4th or 5th year of that. And Also, a program called the Population Health Clerkship every fall brings second-year students, which I think is how we got Vanessa, and nursing students together. And we've had a really great group for several years now, continuing the work. So the students give me a lot of energy and bring a lot of enthusiasm to this. So that's a great part of the program.
That's how UMass Medical School rolls, you know.
Right.
It's really very refreshing to get new people with every year kind of just re-energizing you. So, but maybe now you could give us a little more information about the baby box, because I'm sure people are wondering
What's behind us?
what is behind us. So.
Yeah, so behind us is a baby box. We turned it so you could see what kind of we usually have inside of the blue bag, but I'll start by telling you a little bit about where it came from. So the baby box comes from a tradition in Finland where in Finland usually women and new families would be given a box like a bassinet, and it would be a safe space for baby to sleep. And inside there would be resources for baby and mom and the family to support them during this really special and really crucial time in everyone's life in the family. And so it was brought to the United States by a Los Angeles-based company called the Baby Box Company. And so how we got involved in it was in the forum in 2016 that we had, the Healthy Baby Forum. As I mentioned, we had many community leaders come and represent different aspects of our city. And so we presented different subjects and different topics and projects to address this public health issue. And people voted for the baby box by a popular vote. So this is a community-chosen and community-driven project. And so just to talk about a little bit about how we kind of execute the project here in Worcester is what we usually have is distribution days. And this is one of the primary ways where moms can have access to these, the educational materials and boxes. So they don't require any pre-registration. We just kind of advertise where they'll be. Often they're in churches or their community centers. And so a woman will walk in, and if she's, in her third trimester, she can go ahead and sign in. What we do is we have moms watch a video, and the video basically touches on very important topics: breastfeeding, infant safe sleep, and some other things, contraception, lactation, and such, and so postpartum depression as well. So we have the videos currently available in English and Spanish, which is great. And then we're finalizing now the videos in Vietnamese, Portuguese, and Arabic. So we're really trying to expand so we can serve our community. And so after the women watch a video, they take so beforehand they do a pre-survey, just kind of answering some questions about, how likely are you to talk to your doctor about postpartum depression, or how likely are you to talk to your doctor about, safe sleep, those types of questions. And then they'll watch the video, and then afterwards they'll complete a post-video survey. And then they'll receive a baby box. And inside, I don't know if we can see too well through here, but perfect. So we give new families this very cute swaddle. They're very nice. They're the halo swaddle, so they're pretty easy to put on. We also have some community resources, a book that we have there. Yep, perfect. So some resources, Pernay, one of our partners, topics talking about what it's like to be a new mom, a book for baby as they get older for moms or dads or families to read to them. And then also we have some booklets on milestones and resources in the area, Worcester specific. And inside the bag itself, we also have some diapers and wipes and some soaps and kind of different starter packs for parents. And a onesie as well. And so usually what will happen is we'll go ahead, we'll give, these families this baby box, there's a mattress in it, and then these resources, and then we'll touch base with them after they deliver and see how they're doing and how baby's doing as well. I will point out, though, the distribution days are only one of the ways they can access a box. Other ways are through EMK, Edward M. Kennedy Health Center, which has also partnered with us. We've also had medical students who have called us up and said, hey, I'm on labor and delivery. This mom does not have a crib at all for their house, and is there any way that you guys can meet us and we can, have this mom be provided with a safe sleep for her baby? And so those are kind of some of the ways. We found that with a lot of families, this is from feedback that we've gotten from the families, after they've delivered and after they've had the box for some time, is that they find it really useful because oftentimes families face the financial issue of, do I buy a car seat or do I buy a crib? And oftentimes they go home without a safe sleep space for their baby. So this has provided a space for that. And also, something that kind of points to how much work new mothers do is we found that a lot of women, when we were having feedback from them, would say, it's so useful for me because I bring it, close by into the kitchen or the living room as I'm cleaning or I'm cooking. And so, it's another insight into the busy and demanding lives of parents.
Yeah, and I think it should be emphasized that, one of the reasons that it is such a safe place to sleep is that all of the data has shown now that as much as we always thought that having cushy pillows and blankets and bumpers all around the crib was a beautiful, nice, soft way to have our baby sleep, that increased the likelihood that they were going to have sudden infant death syndrome or suffocation or respiratory issues. So the box has a nice mattress on the bottom, but the walls are kind of barren, and that's with purpose. It's not because we're trying to shortchange the kid their nice soft
Right.
space. They don't need it, and they're better off without it, sleeping on their back in the baby box. So I just wanted to mention, as far as the people that you said have stepped up to help distribute it, that we have 2 student medical groups at UMass now that have kind of taken this on as a project. We have the National Student Medical Association of medical students from the African American community, and we also have the Gold Humanism Honor Society students have kind of joined together to try to help distribute this. And interestingly, part of the distribution is coming at another topic of earlier shows that we've done together here, called the Barbershop Health Network. So maybe you can mention that just for a second.
Yeah. So I also have the privilege of being one of the students working with the Barbershop Health Network and with my colleagues. And so actually, at the end of this month, February 29th, from 11 to 3, we'll be having an event, which is a health fair, but we'll also be having a baby box distribution there. And so at the event, we'll be doing, it'll be at the church called Los Ministerios La Trinidad, which is a mostly Latinx community church, but everyone's welcome. And again, no pre-registration required. And we will have some workshops on mental health, diabetes, hypertension, cervical cancer, breast cancer, and then also safe sleep and lactation as well. So this is a resource for the community, and oftentimes, again, the whole point of our work is to reach those communities that are underserved. So this is what we've kind of combined forces to do, and the next event is coming up soon.
It's very exciting, and some of these things, Sarah, take a life of their own, right?
Right.
As a teacher, all you can hope for is that your students not only get it, but they help to
Right,
propagate
right.
some of the words. So
And
must
one
be very
of the nice
rewarding.
things has been watching the baton hand off too, as the students from who graduated last year sort of pass the project on to the next group. So
yeah.
I did want to say that box is really designed to be for an infant in the first few months of life, and so the goal is that if a family can't afford a crib, that we at least have them have this option. A baby older than 4 or 5 months would outgrow the baby box. So, and our goal is really that no baby born in Worcester goes home without a safe place to sleep. So that's what we want to be able to provide. We've given out about 110 boxes so far, and have shown that the women, the families, part of it is about the education and showing them that the community cares, because we know that in Worcester, it isn't really unsafe sleep that drives the infant mortality rate, but we feel the box gets people in the door and gets them the education that they want, and we teach them about some of the community resources by having it in the community and by including our partners' information in the packets we give them.
So we only have, unfortunately, a couple of minutes left before we have to sign off, but is there anything kind of as we wrap up that you thought you might want to tell our audience or remind them of dates, contact numbers, anything that they need to know?
Yeah, so I'll repeat back kind of just for the distribution day we have coming up. So that's going to be Saturday, February 29th from 11 to 3. And that's going to be at Los Ministerios La Trinidad, which I have the address here, and we can post that as well. It's on 731 Main Street, and there's no necessary pre-registration required. And then the other thing I wanted to point out was if there's a mom who's watching this show and she's wondering, if I can't make it to the event, how else can I get in touch with them? The phone number to call would be 508-755-1228, and that's for Miss Smiley at Pernay. She's the director of operations there, and she's a great contact as well.
Great. And Sara, anything else you need to
Well, I
let
guess I
people
would
know?
go back to what I opened with the title that a baby's health is a city's wealth, and we feel like infant mortality is something the whole city needs to know about and to work towards reducing it and helping, as we said, every baby born in Worcester be as healthy and get as good a start as possible. So thank you so much for having us.
No, I want
Yeah,
to thank
thank
both of
you.
you, Vanessa Villamarin and Dr. Shields. As I said, it's a very special thing to have a 200th show. And I haven't been around for all 200, but it's very nice to know.
One last thing is
Yeah.
our group is open to anyone who wants to participate. We're an all-volunteer group, and we meet quarterly. And our next meeting is Monday, February 24th at the Worcester Division of Public Health on Mead Street at 8 a.m. So you got to be bright and early.
Great.
Hope to see you there. Thanks.
So long, everybody. Come back and see us on our next edition of Health Matters. I'm Mike Hirsh signing off, and congratulations to WDMS and WCCA TV.